Why total joints fail? These are the main four reasons. Malalignment, it wasn't put in right. So it's just like driving your car with the tires not aligned, or your front end line aligned, or the tires not balanced. It just wears out quicker. Infection can occur, fracture of the bone can occur, and most commonly osteolysis means wear debris. In this particular hip replacement, this lady walked into my office with this, by the way. Her socket is completely popped out of her joint. The plastic wore out, and the plastic wear debris signals the body to send special cells to the area called macrophages. The macrophages eat the plastic up or engulf it, but they also give off a substance that makes your bone dissolve. So that's why she has these kind of pockets of bone gone in this area around here. And then, since the bone's not there holding the prosthesis moves, and it becomes painful and fails. Go on. Traditional bearings, these are the ones that have been used since 1960. Cobalt chrome, it's a very hard, smooth metal. It can scratch. If it scratches, it can accelerate the wear. You imagine if you were rubbing something smooth, it's great. But if you put a couple scratches in it, it's like a file rubbing on something, and it's going to generate more wear debris. Plastic, the high molecular weight polyethylene, the particles are generated because of this osteolysis that we talked about, or I talked about. Alternate bearings, they have the potential to last longer. There's less wear debris. Most of them are scratch resistant. These include ceramic on plastic, metal on metal, the improved plastics that we treat with X-ray radiation, ceramic on ceramic, and a metal called oxinium, which is treated with heat and oxygen. Ceramics, these are the second hardest material next to diamonds. They're scratch resistant. There's minimal wear debris when these rub on each other or rub on plastic. The potential for component fracture is there. Whenever we improve something, there's always another caveat. There's another problem that we can bring into it. But ceramics, there have been reports of ceramics fracturing. However, it is very rare. Most of the fractures that occurred in the ceramics had to do with bad manufacturing techniques, and the companies that did that have long since gone out of business. So it's more of a theoretic concern, but it's one that we always have. If you were involved in a motor vehicle accident, high-speed motor vehicle accident, and you had a ceramic on ceramic hip, certainly could fracture. This oxinium is a metal that is treated with heat and oxygen. It transforms the outer layer into a ceramic. Therefore, you get the good and the bad. You get the best of both worlds. You get the hard fracture resistance of the metal, but then you also get the bearing surface of the ceramic. So it's smooth like the ceramic, but it has no chance of fracturing. It's available in hip and knee components. The word they use for the way it rubs on plastics is called lubricious. Lubricious means it's having a slippery or smooth quality. I love this. If anyone's ever been to Disney, this is in the World of Tomorrow. And this is a huge concrete ball that's floating in water, but it's all smooth on the outside. And you can take it, and it's thousands of pounds, and my little 6-year-old can spin it around with his hand because of this lubricious quality to it, because it rubs when it's wet, which anything in your hip would be or in your knee would be. It has very low friction, so it really reduces the amount of wear debris. Revision surgery, again, we talk about this osteolysis or loss of bone from the wear particles. It's difficult to revise total knees and total hips when there's little healthy bone to attach to. We can use bone grafting techniques, and that's what this shows here. This is a patient who his knee had failed, and when we took the components off, all his bone was gone. So what we did was, I don't know if you can see it, doesn't show up very well, but we put this metal screen around the end of the bone. We packed morselized bone graft, and then we're able to cement the component into this, and the bone, the body makes that bone into its own bone, and it transforms that bone graft into its own host bone. That way, if you have to go back again, you have some real good bone to hang another prosthesis on. Go on. Surgical treatments for the knee. There's different compartments in the knee. It's a good time to talk about this. The knee has, when orthopedic surgeons are talking about this, it has 3 compartments. Your knee is sort of like a hinge, but it also rotates, so it's not just as simple as a hinge. But you have the inside condyle, the outside condyle called the lateral condyle, the inside called the medial, and then you have underneath your kneecap. So there's 3 compartments of the knee, and they can wear out in different rates. Most people that you see, like people that, a little bow-legged, they're wearing out on the inside part of their knee first. the outside part and underneath the kneecap may be in good shape. So you may be able to do a more minimal surgery by just replacing one compartment, just replacing this part and leaving the healthy parts behind. And that way, if this part wears out that you replaced, when you go back in, it's an easier surgery because most of the patient's host bone or original bone is still there. So we can do either of these compartments, or we can just do the patella compartment. We can do bicompartmental, where we do the medial and the patella. We can do cruciate substituting knees, where we leave one of the ligaments, and we can do cruciate substituting knees. Also, we can use this oxinium metal in knees. So these are all the different surgical treatments for the knee. Unicompartmental knee, again, this is of one compartment's involved, either the medial, lateral, or underneath the kneecap. It's a less invasive surgery. It preserves bone. Has a more natural feel to it because all of the four major ligaments of your knee are all preserved. You get a quicker recovery. Most of the studies show it lasts about 10 years. The revision surgery is much easier. The main reason it fails is because the other compartments wear out. And that's why people have knee pain, because that one feels fine, but the other ones are wearing out, and they end up having a knee replacement. Yeah. Patellofemoral, this resurfaces just underneath the kneecap and the front of the thigh bone. There have been many versions over the past 20 years, poor instrumentation. There's some newer designs available that make it much easier, and it's available in this oxinium metal. And it's also an easier revision if you have to go back and do it because the rest of the knee wears out.